Hip pain when sitting, causes and treatment. Medical conditions, injuries, and incorrect posture can cause hip pain when sitting. Treatment may depend on the underlying cause but may include stretching regularly, massage, and over-the-counter pain relief. A person can experience pain in one or both hips when sitting. Hip pain while sitting can range from mild discomfort to severe. The hip joint may also feel stiff or pop while sitting. This video explains potential causes and treatment options for hip pain while sitting and when to see a doctor. What does hip pain when sitting mean? Hip joint pain will affect the mid-groin area. People may also experience hip pain in the surrounding muscles, ligaments, nerves, and tendons. According to the Arthritis Foundation, the hip is one of the body's largest weight-bearing joints. It is where the thigh bone meets the pelvis to form a ball and joint socket. The hip joint consists of two main parts, the femoral head and the acetabulum. The femoral head is a ball-shaped bone at the top of the thigh bone. It sits in the acetabulum, which is a socket in the pelvis. The following muscles surround the hip: gluteals, which are the buttock muscles; adductor muscles, which are the inner thigh muscles; iliopsoas muscle, which begins in the lower back; quadriceps, which are four muscles in the front of the thigh; hamstrings, which are the muscles on the back of the thigh. Major nerves such as the sciatic nerve and blood vessels also surround the hip. Hip pain that occurs on the outside of the hip, buttock, and upper thigh may result from damage or injury to the muscles, tendons, and ligaments. Posture and sitting position. The following may cause hip pain when sitting. Incorrect posture. Regularly sitting hunched over can cause hip pain. Sitting without proper support for the back or hips increases pressure on the hips, and the strain can cause pain over time. Sitting positions. If a person sits cross-legged or leans over to one side, they can put more pressure on their hips, resulting in pain. Sitting on an uneven surface. Sitting on an uneven surface such as a cushion or chair that is too soft may cause the body to tilt to one side and put more pressure on one's hip. This may cause improper posture and pain in the hip while sitting. Pinched nerve. Sitting for long periods or in certain positions may cause a pinched nerve. The medical term for a pinched nerve is radiculopathy. It occurs due to stretching, compression, or constriction of a nerve or set of nerves. When this occurs in the hip, it can cause pain in the thigh, buttocks, groin area, and hip. A person may also experience loss of movement, numbness, tingling, burning sensations. Treatment. Treatments for radiculopathy may include stretching, anti-inflammatory medication, hot and cold treatments, rest. Sciatica. Sitting for prolonged periods or in physically awkward positions can lead to sciatica, which is pain caused by irritation of the sciatic nerve. The sciatic nerve is the longest and widest in the body and runs from the lower back to just below the knees. Sciatica can cause pain in the buttocks, feet, toes, and the back of the leg. People may develop weakness, numbness, and a stabbing, shooting, or burning pain that can range from mild to severe. Treatment. Treatments for sciatica include exercises, stretches, pain relieving and anti-inflammatory drugs. Bursitis. Bursitis develops in and around the joint due to the inflammation of the bursae. Bursae are small sacs that cushion the areas between bones and muscles and reduce friction on tendons. Bursae become inflamed when too much friction causes them to fill with liquid in an attempt to protect the tendon. There are two major bursae in the hip that may become inflamed: the trochanteric bursa and the iliopsoas bursa. According to the American Academy of Orthopedic Surgeons, the main symptoms of trochanteric bursitis is pain that begins at the point of the hip and extends to the outside of the thigh area. Initially, the pain is sharp. The pain can worsen when getting up from a chair after sitting for prolonged periods. Some people may be unable to sleep on that side because the pain wakes them up at night. Treatment. Treatments for bursitis include pain and anti-inflammatory medications, physical therapy, splints and braces, hot and cold treatments, exercise, rest, surgery. Tendinitis. Tendons are fibrous tissues that join muscle to bone. When inflamed, they can become irritated, swollen, or painful. When tendinitis affects the hip, healthcare professionals may refer to it as iliopsoas tendinitis. Symptoms include pain in the groin or front of the hip. People may also notice snapping or clicking sensation. Treatment. Treatments for tendinitis include rest, ice, compression, and elevation. Physical or occupational therapy, splints, braces, or slings. Pain and anti-inflammatory medications, corticosteroids injections, surgery. Osteoarthritis. Osteoarthritis is one of the most common types of arthritis. It is a chronic condition involving cartilage breakdown, allowing bones to rub together. This can cause pain, stiffness, and loss of movement. People with osteoarthritis in the hip may also feel pain in the groin, buttocks, or thigh. Treatment. Treatments for hip osteoarthritis include exercise, weight management, and surgery. Rheumatoid arthritis. Rheumatoid arthritis is a chronic inflammatory disease. It occurs when the immune system mistakenly attacks the joints. Rheumatoid arthritis in the hip may cause stiffness, pain, and swelling in the hip, thigh, or groin area. It usually affects both hips. Treatment. Treatments for rheumatoid arthritis may focus on managing flare-ups and include pain and anti-inflammatory medications, hot and cold treatments, topical products like gels, creams, and patches, a balance of rest and exercise. Home remedies for hip pain when sitting. The following tips may help a person improve hip pain that occurs while sitting: using a seat with back support, stretching regularly, wearing flat, comfortable shoes, adjusting the height of their seat, applying heat or ice to sore areas, massage therapy. Diagnosing hip pain. A doctor, orthopedic surgeon, or physiotherapist may perform tests or scans, including tests to check movement such as the gait test or Patrick's fever test, blood test to check for infection and autoimmune diseases, an X-ray, an MRI scan. Speaking with a doctor. If hip pain while sitting is severe, does not go away, or worsens despite home remedies, people may benefit from speaking with a doctor. They can also contact a doctor if they experience other symptoms of autoimmune diseases, such as pain in other joints. If someone has fallen, injured their hip, or has difficulty with everyday activities such as walking upstairs, they may need to see a doctor for treatment.